folk song about my get up and go as got up and went. And one of the verses is something on the line of, I awake every morning and gather my wits. I open the paper and I read the obits. If I am not in them, I know I'm not dead. So I eat a good breakfast and go back to bed. Energy. Without it, life is pretty awful. We've known about energy for a long time. When I was a schoolboy, everyone learned that mitochondria convert the potential energy of food molecules into ATP. Later, when I taught biology and cell biology, my students all learned about the mighty mitochondria, the powerhouse of the cell, and that ATP means energy. Nobody missed that on the exam. But it was back in 1857 that von Kolliker saw granules in muscle cells. In 1886, Altman called them bioblasts and believed them to be organelles of cellular activity, which is, of course, true. In 1898, Benda named them mitochondria from the Greek mitos, thread, and chondros, granule. Then in 1929, Fiss and Sabaro isolated ATP, the cellular vehicle of chemical energy. But the vitamin mitochondria energy story actually began decades before we knew about ATP. And a big part of this story was experiential. It was the story of a lack of energy, a fatally severe lack of energy, called beriberi. And the story of beriberi actually unfolded in Indonesia and in Philippines. So Dr. Homer said, I'm reluctant to travel, but for this talk I almost had to. Beriberi has been a problem for centuries. It was described at least as early as 1580 as beriberi, a disease of the peripheral nervous system. And while today it's said that in medical textbooks and nutritional records that this disease is extinct, we don't have it anymore, I'm not entirely sure that's the case. Now, the extreme disease of beriberi results in extreme symptoms, such as terrible fatigue, as well as pain, neuritis, paralysis, swelling, anemia, decreased liver function, wasting away, and death. Note that wide variety of symptoms. The Dutch physician Christian Eijkman came to Indonesia in 1886, where as many as 25% of prisoners had beriberi. Now, Eijkman thought, like most people thought, that the disease beriberi was caused by germs. This was the time when the germ theory was just beginning to get established, and the theory was, of course it's caused by a germ, let's find the germ. But as they searched, they found something rather plain, very important, and quite unexpected. You know, when people are dying from a disease, you don't tend to say, oh, you're just eating badly. That's an excuse almost. It's hard to believe that that could explain it. So it's very difficult, especially back in the 1880s, 1890s, to realize that bad diet could cause a disease that is so severe, affects so many, has such terrible and varied symptoms, and kills folks. So prisoners with beriberi had been fed polished or milled white rice. Eijkman fed the same white rice diet to chickens, and guess what? They developed the same symptoms. Now, chickens and people that were fed unmilled natural brown rice were cured. Well, that's pretty dramatic. Later on, in 1929, Eijkman would receive the Nobel Prize for his work. Now, Casimir Funk, a Polish biochemist living in London in around 1911, found that there was something in the outer husk, the rice hull, the part that's milled off and thrown away or given to cattle. It was a nitrogen compound. In fact, it was an amine. It was vital to health, so it was a vital amine, or as they say in UK to this day, a vitamin or vitamin. The name stuck, it became generic. In the United States, if you're going to blow your nose, you ask for Kleenex, you don't care which brand you get. In Australia, if you're going to clean your carpet, you hoover your carpet. These are examples of generic names. Between 1909 and 1916, the American R.R. Williams, working in Philippines, began curing beriberi in young children with outstanding success. Now, rice polishings contained this vital amine, and they believed it was just one thing. But as it turned out, there was more to it than that. Over time, it became clear that it was not one vitamin, but it was a group of vitamins, now known as the B complex, all of which, along with vitamin C, are water-soluble and absolutely essential. They cannot be made by the human body. The conspicuous exception, I suppose, is vitamin B12, which to some extent can be made in your intestine. Another good reason to have your probiotics and eat your yogurt and don't take a lot of antibiotics and listen to our previous presenter. You have an opportunity to make B12 to some extent. Thiamine, vitamin B1, the first discovered, along with riboflavin, niacin, pantothenic acid, together drive the oxidation of all three energy nutrients, fat, protein, and carbohydrate. Let's talk about thiamine. Thiamine was first to be discovered and would become known, therefore, as vitamin B1. It proved to be the specific beriberi cure. Nothing else will cure beriberi but thiamine. One part is a thiazole ring. It's a vitamin, thiamine. Thiamine is not stored in tissues. Not surprising with a water-soluble vitamin that you're going to not store it. Once again, while we're here, the exception to that would be B12. Your body actually can hold B12 relatively well. But the B12 story is a little unique. But thiamine is not stored. We need more thiamine when we eat more carbohydrates. We need more thiamine for women carrying a child. We need more thiamine for women that are nursing. We need more thiamine in times of muscular activity. And more thiamine is needed when fighting a fever. Now, thiamine is activated by thiamine pyrophosphate to form an enzyme needed in glucose oxidation. Thiamine is required to either get energy from glucose or to produce storage fat. Without thiamine, these things don't happen. So thiamine is a vital amine, to be sure. And without these things happening, the body doesn't function. It gets tired, it wastes away, and it will die. I used to tell my clinical nutrition students this: a deficiency, a severe enough deficiency of any vitamin is fatal. Vitamins are not just a good idea, they're something we absolutely require. Now, in an age of supplements and fortified foods and choices, we tend to forget that there was a time when people were so fabulously unaware that they simply did not know, and there was no hope for anyone until these scientists came along and said, I wonder if it's their diet. Deficiency symptoms for thiamine include weakened heart muscle and heart failure. Gastrointestinal system deficiency symptoms include anorexia, indigestion, very severe constipation. The whole GI tract slows down, sort of like when people are on narcotics such as opiates. Everything shuts down. Opium and heroin take the whole body and make everything go slowly. I taught college courses inside 2 state penitentiaries, and you see a lot of prisoners that because they were on downers, their entire digestive system is very, very slow. A person that's heavily into heroin might go a very long time without a bowel movement. And when I say a very long time, I mean a couple of weeks. Insufficient hydrochloric acid secretion is another symptom of B1 deficiency, and all of the above result primarily from a lack of energy to the GI tract. If there's no energy, there's no function. Now take a look at these nervous system deficiency symptoms: diminished reflex response, reduced alertness, fatigue, apathy, nerve irritation, pain, prickly or deadening sensations, and if unchecked, paralysis. Continued thiamine deficiency will produce damage or even degeneration of the myelin sheath. That's that fatty insulation on nerve axons. To me, this suggests a relationship to multiple sclerosis. We're going to come back to that because there was a physician named Frederick Robert Klenner who pursued this idea. And here he is. Dr. Frederick Robert Klenner, a graduate of Duke University School of Medicine who lived in North Carolina, back in the 1940s, 50s, and 60s, developed a detailed nutrition protocol to treat multiple sclerosis with vitamins. And it used enormous doses of thiamine, somewhere in the neighborhood of 1,000 times the RDA. When you're giving orders of magnitude more of a vitamin, things change. I am not suggesting that everyone run out and take that much, but if someone has multiple sclerosis, and if you know anyone who has, they haven't received a lot of encouraging information from their physician. And almost no physicians know about Dr. Klenner's work where he actually had good success. His paper was Response to Peripheral and Central Nerve Pathology to Megadoses of Vitamin B Complex. He used more than just thiamine, and other metabolites. This was in the not well-known Journal of Applied Nutrition. Because this is hard to find, this is the link. The Townsend Letter for Doctors and Patients wisely put this up, and it's available as a PDF download. If you can't find it, you go to my website, dryourself.com. Scroll down the left side on the vertical yellow column, and the Klenner protocol is right there, and you can read it. There's also the Reardon Intravenous Vitamin C protocol. You can download that as well while you're at it, although I'm not talking about that today. The U.S. recommended dietary allowance for thiamine is just over 1 milligram a day. And yet, that tiny amount is supposed to be enough to meet the nutrient requirements of nearly all healthy people. I don't think that's true. I think a strong case can be made for a higher dose. Dr. Roger Williams, the brother of R.R. Williams mentioned earlier, Dr. Roger J. Williams said that you should take supplements as nutritional insurance, not to replace a good diet, but to fill in the gaps from a diet that's maybe not so good. And that's why they're called supplements. And this is a reasonable supplemental amount for the general population, in my opinion. Alcoholics need a lot more niacin. Remember when I said carbohydrates require more thiamine? When you look at alcohol, it's a very simple carbohydrate. It's smaller than glucose. When alcoholics drink, they tend to not want to eat, which aggravates their deficiency. And the alcohol itself is a toxin, which aggravates the deficiency. And they probably have other health problems, which aggravates the deficiency. And nobody's given alcoholics thiamine, which aggravates the deficiency. When I taught in prisons, I asked the prisoners, do you get a vitamin tablet here? And they laughed, of course. And I said, well, can you buy one with your own money? They said, oh, yeah, at the prison commissary, you can buy them with your own money. I told them, well, how about you take a good multivitamin with each meal? And they did, and it helped them a great deal. So poor diet and alcohol damage are the twin problems with thiamine deficiency in alcoholics, and thiamine supplementation for alcoholics is extremely important. Now, here's what happens if you don't do it. You can get the DTs, hallucinations, nerve damage, paralysis, WK syndrome, and psychosis. That is a whole lot of stuff that could be prevented for 10 cents a day's worth of thiamine. WK syndrome is a lot more common in alcoholics than the general public, but can also be seen in patients with severe GI disorders. Mentioned earlier, thiamine deficiency can cause severe GI disorders. Infection, as well as fever, raises your need for thiamine. The elderly and those with chronic illness require special attention with thiamine because they tend to eat badly. The elderly, as I mentioned in the previous talk, tend to have a poor sense of smell and a poor sense of taste. And by the way, they tend to not drink enough water because they lose their sense of thirst. This makes it a lot more likely that they're not eating very well. The increase of thiamine that you need during pregnancy and lactation is not small. It is about half again more. You need thiamine for fetal growth, increased metabolic rate, and milk production. Thiamine intake or requirement is also proportional to the amount of carbs you eat and also your body size. All of this makes me wonder how the RDA can be set at that magical 1.1 milligram figure when the variation among people is so great. This kind of drives the point home. The World Health Organization recommends treatment for severe thiamine deficiency by giving intravenous thiamine 50 to 100 milligrams. That's 50 to 100 times the RDA by IV. Now that's a pretty serious amount of thiamine. And then 10 milligrams, not 1.1, but 10 milligrams daily, IM, for a week, followed by 3 to 5 milligrams, again, 3 to 5 times the RDA of oral thiamine for 6 weeks. These are megadoses. Somebody tell the World Health Organization that they're now recommending megadoses of vitamins. The good news, thiamine is found in almost all natural foods, but in very tiny quantities. Good sources include whole grains, seeds, nuts, animal meats, and legumes, peas, beans, and lentils. Could I get some water? Over here? Okay, thank you. A study back in 1975 of about 2,000 American households for a full year showed that among adults 19 years of age or older, over 65% did not get the RDA of thiamine. Now, they're not even getting 1.1 milligrams. 2 out of 3. If you search for this fact today, you will find it has been updated. An analysis of data from the National Health and Nutrition Examination Survey in 2003 to 2006 showed that only 6% of the U.S. population had a usual intake below the EAR. EAR? What's the EAR? The EAR is lower than the RDA. So the Food and Nutrition Board of the National Academy says the estimated average requirement is the average daily nutrient intake level estimated to meet the requirements of half of healthy individuals in a group. I don't know about you, but when I was an undergraduate, this was called fudging, where you play around a little bit with the data or your definition of the data. It's sort of like you have a chemical spill in your neighborhood and they come in and test and they find the chemical, and if they find this much, they say the safe level is that much. So this is where you don't raise the bridge, you lower the river. The EAR is 20% lower than the RDA for thiamine. We could ask, is chronic fatigue a modern name for subclinical beriberi? Questions like this tend to get you in trouble with conventional nutritionists who say, no. But you know, chronic fatigue wasn't even recognized as a legitimate disease when I was a young man. It was regarded as all psychosomatic. Now at least we're beginning to realize that some people are in fact tired and it's not in their head. And there's a very good chance that it's because they're suffering from a thiamine deficiency. Thiamine is cheap, it's safe, And there's much to be said for a therapeutic trial. Now, that RDA is pretty low. I'm suggesting more than that. It was Dr. Abram Hoffer and other orthomolecular or nutritional physicians that have used hundreds of milligrams a day. It works best in divided doses. Some people will take a big balanced B complex, a B50 or a B100, which will have 50 or 100 milligrams of niacin. They'll take that at breakfast. That's inefficient. You'd be better off taking that capsule or tablet and cutting it in pieces, hard to do with a capsule, but easy to do with a tablet, and divide that all through the day. And I think for optimum absorption, 3 times a day is minimum, and you might want to consider even with each meal and between each meal for those who really need thiamine. Thiamine is safe. There are 0 known deaths from it. Toxicity is unknown. In the United States, the American Association of Poison Control Centers receives data on who dies from what from 57 centers coast to coast. And I have personally looked at this information. They've been tracking it for about 35 years. There are 0 deaths from thiamine, absolutely 0. So this stuff is safe. I have suggested thiamine to people in the past, and many of them have come back to me and said they now have too much energy. You gotta love that. You know, it's almost as if the body knows what it's doing. Vitamins do not give you energy, but thiamine and other vitamins release the energy from the food you eat. Without the vitamins, that's not going to happen. No wonder people are so depressed and tired and achy and miserable. Thiamine, apparently, can interact with lead and prevent tissue accumulation. Lead poisoning is a major problem, especially with children, in areas of the world where lead exposure has been very high, and you can actually prevent clinical symptoms and death by using thiamine. Therapeutic doses of thiamine may be of value in the prevention of lead poisoning in cattle, in other animals, and in humans exposed to high levels of lead. Let's talk about niacin. That's vitamin B3. There are several forms of niacin. A lot of people ask this question, so I wanted to take the opportunity to make it plain. Niacin was originally called nicotinic acid. It is structurally similar to nicotine, but it is biologically entirely different. Niacinamide has most, but not all, of the properties of niacin, but niacinamide does not cause a flush. Niacin in high doses, or even modest doses, will often cause a beet red, heat, flushing, itching that will last anywhere from a few minutes to a few hours. A lot of people don't like that, so they use niacinamide. But niacinamide does not lower LDL and triglycerides, and niacinamide does not raise HDL. Therefore, we need a form that doesn't cause a flush, and that's inositol hexaniacinate. Inositol hexaniacinate can cause a flush in some very sensitive people, but it is really unusual. We're talking less than 5% at most. It's a little bit more expensive, and it doesn't work as well. I would estimate you'd have to double doses if you use inositol hexaniacinate. My source for this is Dr. Abram Hoffer, my mentor, who is one of the great niacin experts on the planet. All of these are water-soluble, all of these are white powders, and all of these are very stable. They are heat-stable, they last a long time. The deficiency of niacin is pellagra, vitamin B3 deficiency. And now take a look again at the energy-related symptoms from a deficiency of niacin. Weakness, lassitude, dermatitis, diarrhea, dementia, and death, the 4 Ds. A closer look at the deficiency symptoms: weakness, lassitude, anorexia, indigestion, skin eruptions, neuritis, confusion, and apathy. Niacin in the body is a coenzyme partner along with riboflavin, vitamin B2, in converting proteins and some glycerol from fats to glucose. It also acts as a coenzyme in oxidizing glucose for energy. Mentioned earlier, side effect of niacin therapy, flushing almost always. If you recommend niacin to someone, the odds are very high that you will get a flush. I was giving a talk once to a group similar to this, and I demonstrated the niacin flush towards the end of the seminar by taking a few high-dose niacin tablets, I don't know, 1,500 milligrams or something. And when I started to announce this, there was a fellow in the back room who, from somewhere, pulled out a pair of binoculars. Now, you don't normally take binoculars when you go to a medical conference, but he just happened to have a pair. He must have heard that I was coming. And it's very unnerving to give a talk when someone's watching you with a pair of binoculars. Perhaps he was from the FDA and I didn't know it. I handed out evaluation sheets like I always do. How am I doing? What did you like? What did I do wrong? What do you want to hear more of? Other comments. And somebody wrote, and I think it was him, quote, "The niacin flush was awesome. Do you do birthday parties?" I'm not making this up, although sometimes it must sound like I am. That flushing can be accompanied by the skin itching, and actually most people object to that a lot more. The itching is such as if you might feel it's a mosquito bite or a flea bite or something like that, and that will pass. Sometimes blood pressure will drop. Sensitive individuals taking a lot of niacin may actually feel woozy. They might feel faint, they have to lie down. One of the ways I avoid this is I gradually introduce niacin. I recommend that people gradually increase it. Or, if you have reason to believe the patient is sensitive, you can go right to inositol hexaniacinate or niacinamide. Nausea is the sign of massive niacin overdose. Dr. Hoffer said, you'll throw up before it will hurt you. So niacin has this wonderful ability of making you vomit if you take too much. Side effects vary of dose, of course, the patient's need, and the volume of food or liquid consumed. If you take niacin, chew the tablet, and have some hot coffee, you're going to have a flush very, very quickly. On the other hand, if you had a big holiday dinner and you took your niacin in the middle of that meal, the flush might not happen for 2 or 3 hours after your meal, just long enough for you to forget that you took the niacin. So niacin is a vasodilator. Niacinamide is not. Niacin, but not niacinamide, lowers serum cholesterol. And inositol hexaniacinate works like niacin does, without a flush, still helps the blood lipids, but requires a higher dose. I repeat this because this is one of the most common questions we get. 9 out of 10 questions I get with niacin has something to do with the flush. For other things than blood lipids, you can use niacinamide interchangeably with niacin. We mentioned last time, I think, arthritis and mental disorders. It is extremely rare for niacinamide or inositol hexaniacinate to produce a flush. Pan deficiency disease is a deficiency that's spread all through the nation or even through the world. Dr. Harold Foster and Dr. Abram Hoffer believe that we have a population-wide deficiency of niacin. Vitamin dependency is where individuals need unusually high amounts for their own particular state. Dr. Hoffer was asked, how dangerous is niacin therapy? And he said, you're going to live a lot longer. Is that a problem for you? Dr. Hoffer treated former prisoners of war. After World War II, Canadian soldiers coming back to North America who had been in prison camps had severe nutrient deficiencies. After as much as 44 months of captivity, a quarter were already dead. The ones who survived had lost a third of their body weight. They had all the classic deficiency symptoms. They were suffering from deficiency of protein and calories in general. And when they were given therapy with vitamins, they generally improved a little bit. But a lot of them did not, because they didn't have a deficiency. They had a dependency. It was so bad for so long. I think it would be like a child that was homeless in the first 2 years of its life. Might that not affect that person as an adult when they're 30 or 40 or 50? Some things sort of stay with you. You can think of this as a physiological trauma, but whatever the reason, the solution is to simply give the amount of dose that makes the patient feel better. Now, that's such an obvious point that most people would say, why do you even mention it? Because it's all about dose. Now, with pharmacology, everyone accepts that. Dr. Hoffer said to me one day, why don't you write a paper on why you should give antibiotics 500 units of an antibiotic to cure an infection? It's absurd, of course, but there are people that'll give 500 milligrams of vitamin C and call it a therapeutic dose. There are people that will give the RDA of a vitamin and call it a therapeutic dose. And remember, even the World Health Organization doesn't buy that, and they're pretty conservative. So here's the number. Dr. Hoffer would give usually 3,000 milligrams of niacin a day. The RDA is 18. We're talking astronomically larger doses than most nutrition textbooks would sanction. But it worked. Said Dr. Hoffer, these patients recovered and remain well as long as they take the vitamin regularly. That's a dependency. Dr. Hoffer said that even 40,000 milligrams a day of niacin is not toxic, but this is another common problem, which I think I touched on last time, so we'll go through it quickly. Liver damage and jaundice are frequently and usually erroneously blamed on niacin use. But it was William Parsons, Jr. of the Mayo Clinic, a terrific niacin researcher, who wrote the book I reference here, Cholesterol Control Without Diet, the Niacin Solution. He emphasized that elevated liver enzymes indicates liver activity, not liver pathology. And this is an extremely common problem for general practitioners who don't have experience with niacin. They see those enzyme levels go up and they say, whoa, stop the niacin. Parsons says that's nonsense. If they go way up, maybe. And they're more likely to go up in people with pre-existing liver conditions and in alcoholics, and with people that take proprietary niacin, such as niaspan. There are far more side effects with sustained-release niacin. Now, why do they give sustained-release niacin? To avoid the flush. But you can avoid the flush by using inositol hexaniacinate, which is cheaper and safer. I have no financial connection with the food products or vitamin industry, by the way, so when I mention these things, it is just because Dr. Hoffer taught me, and he emphasized that that increase in liver enzyme numbers is a sign of activity, not pathology. So in 55 years, Dr. Hoffer treated over 5,000 patients with extremely high doses of niacin. People asked him about jaundice. And this is an exact quote from Dr. Hoffer. Since he started this in 1952, he has seen a few cases of obstructive type jaundice, which cleared when niacin was stopped. And in one case, I had to resume the use of niacin because the patient's schizophrenia came back. He recovered, the jaundice did not come back. I have seen so few cases of jaundice that there is little evidence that the jaundice arose from the use of the niacin. But some people might get jaundice from some other reason. There are many reasons why someone might not be completely well, and if you blame the vitamin without looking into it, naturally you're jumping to conclusions. In 15 years, he reported that he saw no cases whatsoever. The main danger from taking niacin is not jaundice, it is that people will live longer. The MRCA study back in the mid-70s showed that 43% of American adults get less than the RDA of niacin. The RDA is quite low, the EAR is lower. I think most people would do well to take a few hundred milligrams of niacin a day, or if they're sensitive, niacinamide. Food sources include fish, legumes, again, meat, mushrooms, and whole grains. Let's look at riboflavin. Riboflavin contains ribose sugar, and it's yellow in color, so there's flavus, and that's how it got its name. Light destroys riboflavin. That's why vitamin bottles are opaque or brown or green. Deficiency of riboflavin. Tissue inflammation, wounds that don't heal, cracks around the nose, lips, and mouth, swollen, reddened tongue, itching, burning eyes, scaly, greasy skin. Riboflavin levels are characteristically low in arthritic patients, and sometimes depression will respond to riboflavin. But riboflavin deficiency is actually not particularly common in nations where they have dairy products. Riboflavin is part of the enzyme group called flavoproteins. They are part of cellular respiration. Here we go again, back to energy release, and part of the deamination process. The RDA is, again, very low, 1.5 milligrams. I think that could be raised and should be. Food sources include whole grains, organ meats, and vegetables, and as lactoflavin, milk. And this is why riboflavin deficiency is actually not very common. Anywhere people are having cheese and milk and other dairy products, there's a pretty good chance that they're not going to be short on riboflavin. But if you cook food in an open pan, the light will destroy the riboflavin, and perhaps this is justification for a romantic candlelight dinner. When people supplement, it's common to take a 20 or 50 milligram dose, and I would divide that through the day. And riboflavin in that dose will turn urine a brighter yellow-orange. So not only is riboflavin destroyed by light, it's also the one that turns your urine a little darker. Thiamine is the one that makes it smell differently. I just thought you'd like to know that. And if you take enough niacin, you'll be so warm and relaxed you won't even care. Pantothenic acid is everywhere. It's in all things, hence the name. It's activated by ATP into coenzyme A. Coenzyme A enables acetylation, and there is very wide biochemical work for pantothenic acid. The RDA is slightly higher, 4 to 7 milligrams. Toxicity is unknown, and no deficiency state actually exists. You're probably thinking, well, why are you talking about it? Well, you don't have to worry about riboflavin and pantothenic acid, but they are both intimately involved in the energy process, which is the topic of this talk. And when I come back and emphasize thiamine and niacin, you'll realize why I'm not emphasizing pantothenic acid and riboflavin. So to review, the discovery of the B vitamins is the story of fatigue itself. Beriberi, an incurable condition with no effective medical treatment whatsoever, was found to simply be a deficiency of thiamine. Eating whole brown rice instead of processed milled rice was enough to get the cure. Of course, in your body, food must be broken down. In your cells, energy must be released. This whole process is vitamin dependent. The B vitamins and magnesium are particularly important in that energy releasing pathway. I would say that the human body without enough B vitamins is like a huge rusty machine without any oil. All the parts are there, but it's not moving. So the 4 B vitamins most involved with cellular energy are thiamine, niacin, riboflavin, and pantothenic acid, the first 2 being the most important. It is almost certain that the rest of the B vitamins are also involved, but to a lesser extent, in energy release, including B12, B6, pyridoxine, folate or folic acid, and biotin. All of these are found in a multivitamin. All of these are found in a B complex supplement. It is cheap, easy, and safe for people to supplement with extra B vitamins. Does the shotgun approach work with the B vitamins? It actually does. The B complex is sort of like a soccer team, like a baseball team. Now, I'm a Yankee from New York State, and we have a baseball team by that name. They're not quite as good a team as they used to be. But the fact is, when the Yankees won the series, they didn't do it because they had just Derek Jeter. They had the other guys also. Now, my father was a minor league baseball pitcher. Did you know that? He had a tryout for the Yankees. And he got out there, and he was like 19, and he had his best stuff. And he was burning the ball over the plate, throwing hard. And the pitching coach then got up from behind the catcher, pulled his mask back, and said, "Okay, Saul, let's see your fast one." And that's when my father knew that he was good, but he wasn't good enough. Why am I telling you this? Because it's 3 in the afternoon, and some of you are nodding off. That's why. Any baseball fans here? No, just a few. Well, my father, when he was a young man, struck out Bobby Brown twice in one game. Bobby Brown would become a World Series Yankee, the president of the American League, and a medical doctor. And my dad fanned him twice in one game. I just thought I'd throw that out there. And now it's on the video, so my grandchildren will see that. Oh, was he really? But it's a team, it's a team, it's a team. The B vitamins work synergistically. That's the funny thing about nutrients. They work better when you bring them together. And we all think polypharmacy. Ugh. The danger of drug interactions, and it's real. But with vitamins, the danger is to not have all the factors. That's the whole idea of a balanced diet, isn't it? So I recommend a B complex with each meal. It's convenient, it's safe, it's cheap. Why not try it? If you have a patient with chronic fatigue or some of these other symptoms that aren't going away, you could do a therapeutic trial and see for yourself if it works. Now let's look at vitamin C. One patient told me, "I went to my family doctor complaining of increasing drowsiness at work. He said, 'You're getting old.' I started taking 3,000 milligrams of vitamin C and other supplements one day. After 1.5 years of gradually increasing the dose, the level of drowsiness and my declining cognitive ability, unable to concentrate, and severe memory loss enabled this person to take even more. They took not 3,000 a day, but 1,000 an hour. Next day, bam, my energy level was back to my preteen level or better. I had that spring in my step. I worked for 8 hours, studied on the computer at home for another 4, wasn't sleeping or tired, and since then I've only had minor drowsiness 6 times. This is a spectacular change. So, would vitamin C help chronic fatigue syndrome? Chronic fatigue or chronic fatigue immune dysfunction syndrome is really pretty serious. There's about 200,000 cases in USA every year. It is described as treatable, but regarded as incurable. Go to any medical website and they will tell you that. They will tell you the cause of the condition is unknown. Ding! Whenever I see that phrase, the cause of the condition is unknown, I think nutritional deficiency. And it's more common in women by far than men. In fact, I haven't yet seen a man with chronic fatigue. I'm sure they're out there, but they're just staying away because they're too tired. Here's 2 examples. A 45-year-old woman with chronic fatigue told she had to learn to live with it, a common refrain. She was not happy. Another was a 38-year-old woman with multiple chemical sensitivity, including allergy to printer's ink, and she was a librarian. So that was a problem for her. Both recovered spectacularly when they took vitamin C 30,000 to 50,000 milligrams a day. And what's really funny is the librarian. She worked in the city downtown, and she was in a hurry. So she went from taking no vitamin C at all to taking 30 to 50,000 in one morning. So she's walking down Main Street, and gets to bowel tolerance. That's what she told me, and she had no reason to lie. But aside from that, her symptoms were gone. Now, this is a woman who had to wear gloves and practically a respirator if she was going to do her job, and when she took enough vitamin C, her problem went away. Where did this come from? Let's look at the work of Dr. Frederick Robert Quenner. Dr. Levy has been mentioning Dr. Quenner for a long time, so have I, because he's so important. And he describes this fatigue in a 1948 paper on treating viral pneumonia. Now, Quenner was a board-certified chest physician. That's why he would tend to see the pneumonia cases, and that's where he had spectacular results, as well as with polio, using C. So hear this now. The picture will then develop to the point where severe frontal headache is noted, along with a feeling of weakness in the lower extremities so marked that the patient complains of a dragging sensation when moving about, even in bed. The weakness persists for days. The patient can hardly support his weight without the fear of buckling at the knees. And this is why Quenner thought vitamin C was important, because this fatigue symptom with pneumonia is suggestive to him. So he had 42 cases in a 5-year period where he gave vitamin C in massive doses. Now, Southern Medicine and Surgery is not the biggest medical journal in the world, but it was peer-reviewed, a regional journal, and Quenner had approximately 20 publications in journals. At my website, I have a complete bibliography of Frederick Robert Quenner if you want to just follow that down. So a doctor yourself, use the search function and put in KLENNER and sit down, because you're going to be busy for the next couple of days. We actually have his papers and links to whatever we can find. Fascinating, fascinating story of high-dose C. Indeed, he was the pioneer of megavitamin C therapeutics in the 40s, giving these doses by injection as well as orally for a wide variety of illnesses. Nice little side about Dr. Quenner, he worked in Reidsville, North Carolina, a fairly rural area, and although he was a board-certified specialist, he also had a general practice. And a lot of his patients were very, very poor. And this came out after his death when they talked to people that knew him. He would go and make house calls no matter who the person was, whether they could pay the bill or not, and he didn't even care if he didn't get paid. He still kept them as patients, and he saw them pro bono. So he was a very kind man. So Quenner used 350 to 1,200 milligrams of vitamin C per kilogram body weight per day. This is approximate. There were times when he used more. Working it out in normal terms, that's around 20 to 35,000 milligrams a day at the low level for an adult, and at 1,200 milligrams per kilogram, it's hitting in the neighborhood of 100,000 milligrams a day. That's a lot of vitamin C. But Quenner is one who would say, don't send a boy to do a man's job. The way I say it to people is, you take enough C to be symptom-free, whatever the amount might be. Everybody asks, how much C do I need? The answer is, I have no idea. But you can find out. You take it, you feel better, good. You take it more, you feel better still, good. You take so much you get to bowel tolerance, well, your body's saying that's about enough for you. And everyone can determine that. And remember, not only are we all different, but you're different from yourself on a different day in your different circumstances. And blood tests for vitamin C are silly because it's water soluble, and you're going to find if you have a blood test at 10 in the morning, by 1 in the afternoon, it's all changed. So this no technology approach, very, very user-friendly. And of course, it's too simple, isn't it? It's safe, it's simple, and effective. Well, that can't be it. It's certainly not on the news. But Quenner treated polio and pneumonia with vitamin C, and that should be on the news. I wrote a paper reviewing his work, which is published at dryourself.com as well. And his papers on vitamin C are very highly recommended to you. So look what he treated with vitamin C. Now, we're moving a little bit away from mitochondrial energy, but I just can't resist. Can you? Bladder infections, arthritis, leukemia, atherosclerosis, ruptured discs, high cholesterol, corneal ulcer, diabetes, glaucoma, burns, heat stroke, radiation burns, heavy metal poisoning, chronic fatigue, and complications resulting from surgery. And multiple sclerosis. You can also find on the internet a rare book, which I believe is out of print, called Clinical Guide to the Use of Vitamin C, edited by London Smith. London Smith was a very popular television doctor in the US. He actually won Emmy Awards, something Linus Pauling didn't even do. London Smith was on the Johnny Carson Tonight Show dozens of times. Very popular doctor. And he compiled Quenner's work in this book, which you can find at these addresses, or do a Google or Yahoo search and look for the Clinical Guide to the Use of Vitamin C by Quenner. It's a short book, full of information, full of dosage information, very specific. And this is my biography of Quenner. I think it's interesting that mononucleosis symptoms kind of resemble chronic fatigue syndrome symptoms. It was Dr. Cathcart, Robert Fulton Cathcart III of California, USA, who treated patients with a tablespoon of vitamin C crystals every hour. Now, that's really a lot. A teaspoon is about 5 grams. So a tablespoon, which is 3 teaspoons, I suppose your metric over here, which is good, because this tablespoon, teaspoon thing, I mean, how many gills in a furlong anyway? You know, we have a very large amount of C being taken here. That's 15,000 milligrams an hour, over 150,000 milligrams a day. But when someone has mononucleosis, this cures it in a matter of days. Now, you know people that have had mono, it often takes them a very long time. When I was in college, I remember somebody that had it for weeks and weeks and weeks. So this is a useful tool. Cathcart is the one we can thank for the bowel tolerance principle. It is still overlooked. Here's another paper by Quenner that was in Medical Hypothesis on the treatment of AIDS with massive doses of vitamins. Now, I know that chronic fatigue is not AIDS, but I want to mention that the immune deficiency component of CFID suggests that maybe vitamin C and fatigue and the immune system have a common link. This is a review slide. People ask, is there any way to get megadoses of vitamin C without taking supplements? The answer is a qualified yes. It's wheatgrass. And that's just what you think it is. You take wheat and you sprout it. Take a tray, put the wheat kernels on it, cover it with about a ½ inch of soil, water it, and it will grow, and it will look just like grass. When it gets about 5 inches high, you just cut it with scissors, and then you get to put it through your juicer. And by the way, juicing grass is very difficult. So it gets all clogged in there, so you're just in for a lot of fun with this. So you need usually a masticating or chewing juicer as opposed to a centrifugal juicer, or a grind and press juicer, which are more expensive. I use a masticating juicer, and I add a little water, and then I'll add a piece of zucchini or a carrot, just enough to keep the wheatgrass going through, and I make a blend. Wheatgrass is very high in vitamin C. You can also sprout other things: cabbage seed, lentils, alfalfa, radishes, whole barley, and sunflower seeds. And sprouts in general are very good sources of vitamin C. Vitamin A is beta-carotene. Vitamin A deficiency certainly weakens the immune system, and fewer than 10% of us are consuming enough beta-carotene. Let's talk about magnesium briefly. It is essential in the energy release process. Magnesium is a catalyst for hundreds of biochemical reactions in each of your body's cells, and it's necessary for nerve conduction and muscular activity. The RDA is about 350 milligrams a day. Most people in the UK are not getting this, and magnesium deficiency is very high in teenagers in America. I think magnesium supplementation should be part of your first-line approach to chronic fatigue. How much? As much as the patient can hold without bowel tolerance. Magnesium does have a laxative effect. You can maximize success by dividing the dose. And I think taking magnesium between meals is more effective, and I actually take it in the middle of the night. Because, you know, the older you get, the more you have a chance to take magnesium in the middle of the night. And that way your absorption is better. So divide your dose. People ask about forms. Magnesium oxide is the most common and is the worst. It's the least absorbable, but it's the cheapest. When you read a supplement label, read the side panel and look to see if it's magnesium oxide. You'll sometimes see a magnesium complex, and you read the side panel and the major ingredient is still magnesium oxide. Magnesium gluconate and magnesium citrate are better, and magnesium chloride is better still, and there are other forms of magnesium as well, but oxide is the least valuable. For some people who are very deficient, even magnesium oxide is a big help. And then there's Epsom salts baths. Epsom salts is magnesium sulfate. You just throw a cup of that in a nice hot bath and soak, and you absorb it through your skin. Transdermal absorption is fun. There's nothing like relaxing in a hot bath. You should do that anyway. It does the body good. Throw in some magnesium sulfate, and now you'll get magnesium as well as a relaxing moment. And yes, you're way ahead of me. Another good source of magnesium, you'll be delighted to know, is dark chocolate. So 4 squares of dark chocolate provides the US RDA of magnesium. And the way I see it, there's no excuse for anybody to be magnesium deficient. There are, of course, other key nutrients in energy production, but these are the ones that I would like to highlight today. This one you want to look at. There's a really good summary table of all the vitamins and minerals involved in energy release. In the journal that I cite here, table is on page 280 to 281. You want to be sure to get that and print it out because it's very, very complete. And in preparing this, I want to establish that I very much appreciated that paper. It's a very, very good thing to look at. And they go into this in greater detail than I can. Now, there's this idea that if vitamin supplements work, they can't be safe. But there's a very long track record of supplement safety. Abram Hoffer said no one dies from vitamins. But a battle against supplements has been going on for a very long time. It's funny that critics will cite low-dose studies that don't work in an attempt to show that vitamins don't work, but they can't cite any double-blind placebo-controlled studies of high doses that show any dangers. So vitamins are effective at high doses and also safe at high doses. For those who are interested, the Journal of Orthomolecular Medicine is now in its 50 years of publication, 50th year, and the US National Library of Medicine refuses to index it. And that is the world's largest public medical library on the planet. We've complained, and the people that you talk to at NLM, they weren't even alive 50 years ago when the journal was started. It's all about dose. Low doses don't work. And if low doses of supplements don't work, then certainly you're not going to improve fatigue by giving people the same old crummy diet that brought them in the door in the first place. So there it is. I knew you'd want the poem. Our mitochondria deserve better. My daughter says, Don't take chances. Take vitamins. The Orthomolecular Medicine News Service is peer-reviewed, non-commercial, and free by email. I welcome your subscriptions. And I am very grateful for your wonderful attention, especially in the afternoon. Thank you.